In the previous episode, I have spoken about hip replacement, what is hip replacement, how it is done, and the recovery part. Now, let us discuss about an important topic which most people are not aware is called direct anterior hip replacement. So, what is this and what are the advantages of this procedure? Now, direct anterior hip replacement is a type of a surgery wherein the hip replacement is carried out from the front part of your thigh. Now, why is this important and why is this not routinely done? These are two things which you have to understand. What is this? We basically approach the hip joint from the front of your thigh without cutting any muscle, nerve, tissue, anything. We basically go between the muscle layers, separate the muscle layers and carry out the hip replacement. So, when the surgery is done, there won't be any pain apart from the skin cut because we have not cut any muscles there. So, the recovery is very fast. Chances of one having hip dislocation are very less, and the implant or the hip replacement can last longer because of the better positioning of the components, as this is done robotics or under the image intensifier. Why is this not done commonly? Direct anterior replacement is a technically challenging procedure because of a limited space. When we do a posterior approach, this area is big, we cut all the muscles go side. Because we are separating the muscles and not cutting the muscles, the space is very limited. Hence, it is challenging to do hip replacement through anterior approach, and you need an extensive training and certification to do this kind of surgery. Now, a good hip surgeon who has done more than 100 DAA surgeries in his career are safe to do a direct anterior hip replacement. For surgeon like me, I have trained in DAA in Australia for 1 year under a surgeon who was doing around 4,000 hip replacement every year. So under his mentorship, I have done on my own 220 surgeries, and then I have been practicing direct anterior hip replacement from last 4 years. Individually, I have performed more than 250 direct anterior hip replacement. Now let us understand how it is advantage. Direct anterior hip replacement prevents cutting any muscle or a soft tissue, hence it will not lead to any sort of complications which can arise out of a hip replacement, and also the pain is very less because tissue damage trauma is very less, and the incision, the skin part what we use also is very less, usually typically less than 10 centimeter. This is a normal size of an incision which we use for a hip replacement. So recovery also is very fast. There are some of my patients who have recovered and gone home walking on day 3. If I ask them to hold the support, they say they feel very confident and they walk without support. The major difference between a DA and a posterior approach is pain is very less, recovery is very fast, patients gain confidence very early, and they can resume their day-to-day activity within 15 days. Whereas posterior can take up to 6 weeks to 6 months. So this is a major difference, plus lesser complications in DAA in the hands of a safe, surgically trained surgeon.